Dubai Health Authority, prometric exam questions for nurses. For complete study materials and other assistance, contact Nursing Manthra through WhatsApp on 971 0502 515717. Question number 1. Postoperative patient who underwent an abdominal procedure requests a pain medication from the nurse and rates the pain at a level 9. There is a standing order for narcotic administration. When the nurse opens the narcotic box and performs a count check, the number of pills remaining in the box is different than the number of pills recorded on the sheet. What is the most appropriate initial nursing action? A. Notify the nursing supervisor. B. Write the finding on the narcotic sheet. C. Administer the patient's requested medication. D. Identify the last nurse who used the narcotic box. The answer is A. Notify the nursing supervisor. Question number 2. Surgeon instructs a nurse to serve as a witness to an elderly patient's informed consent for surgery. During the explanations to the patient, it becomes clear that the patient is confused and does not understand the procedure, but reluctantly sign the consent form. The nurse should A. Sign the form as a witness, making a nation that the patient did not appear to understand. B. Not sign the form as a witness and notify the nurse supervisor. C. Not sign the form and answer the patient's questions after the surgeon leaves the room. D. Notify the surgeon that the patient is still confused about the surgery and request to clarify the patient's doubts. The answer is D. Notify the surgeon that the patient is still confused about the surgery and request to clarify the patient's doubts. Question number 3. The nurse manager received complaints from some nurses about improper work distribution and discrimination. How should the nurse manager handle the situation? A. Investigate the complaints. B. Individual counseling. C. Identify list of problems. D. Continue to observe. The answer is A. Investigate the complaints. For complete study materials and other assistance, contact Nursing Manthra through WhatsApp on 971 0502 515717.